Hey guys, hi, welcome back to Unacademy. This channel is Unacademy Future Doctors, and I am Dr. Shivangi Shukla, your educator for biochemistry here on Unacademy. Let me just check if the live stream has started and if I'm visible and audible to all of you. Guys, hear me? Am I visible and audible? Do let me know in the chat section. Okay, great. So, I have conducted a lot of series here on this channel. You guys have been with me for the past 2 years now. Sorry, 2 months, not 2 years. This channel is in its nascent stage. It is a baby channel by Unacademy, and it is dedicated specially for you, the future doctor. And for the past 2 months, I have been conducting the super fast crash series, the rapid revision series, as well as the focus series and integrated sessions with other educators also I have taken, and regular strategy and motivational sessions I have been offering you guys. Now I have come up with with quite a few innovative sessions where what I'll do is I'll make you guys revise the cycles in an innovative manner. Okay, whatever we have read, what I'll do is I'll pick up one cell organelle and whatever associated biochemistry is there with that organelle, that biochemistry we are going to revise. Okay, so it is like another approach, sorry, from another dimension. Okay, all right. And so okay, let's begin then. Okay guys, most of you are regulars here and they would be knowing me. I'm Dr. Shivangi Shukla. I'll just quickly tell you about the different types of subscriptions for Unacademy, for NEET PG that are available on the Unacademy app. Okay, the plus as well as the iconic subscription. The plus subscription comes with access to video lectures from top educators across the country. You can access their live as well as recorded videos whenever you are even while on the go, while traveling. You can access these videos on any device of your choice, get your laptop, your laptop, your tablet, your mobile. Okay, anything. So this is the USP. Okay, it gives you access, it gives you very flexible access. Okay, and you can use state of the art tools like raise your hand feature, clear your doubt, and talk to the educator. Okay, all these things are so that they simulate the physical classroom. And the iconic subscription gives you access to resources from prep ladder as well. Now see guys, the thing is that during the COVID time, what has happened is that physical learning has suffered, classroom learning. Okay, so most of us have shifted towards the online method so as to maintain our regularity. In these unprecedented times, Unacademy has offered you a very inexpensive subscription, and on top of that you can avail additional 10% discount by putting in the educator code DRSHUKLA, Dr. Shukla. Okay, now this code is going to fetch you an additional 10% discount in whichever category, plus or iconic. Okay, so please do not forget to put in this educator code, and I would urge you guys to please try out these subscriptions, because they are very inexpensive and you will really benefit from them. Okay? You'll never regret. Okay, got it? So let us begin. Now we have finished with what have we done? We have done lysosomes, we have done endoplasmic reticulum. We are going to read peroxisomes and mitochondria. Okay, so we'll start with peroxisomes in this session. In the next session, we'll do mitochondria. Okay. Now peroxisomes. As I have told you, what are zomes? What is the meaning of zome? Tell me. By now you would be knowing lysosome, ribosome. What are zomes? Zome is body. Peroxy means peroxide. Peroxy is coming from peroxide. So these bodies synthesize peroxide. Okay, what are peroxisomes? Bodies synthesizing peroxide. What is peroxide ion? Peroxide, what is peroxide? What is hydrogen peroxide? H2O2. Isn't it? H2O2 is hydrogen peroxide. Okay. So, but this hydrogen peroxide it is used for an antiseptic, for disinfection, all these things. But hydrogen peroxide is toxic inside the body. Okay, because it can form what? It can form hydroxyl free radical. What is this? This is hydroxyl free radical. Okay, inside the peroxisomes, how is peroxide formed? How is peroxide converted to the hydroxyl free radical? What can the hydroxyl free radical do? What are the types of free radicals? Are free radicals good or bad for us? What do free radicals do to our body? Molecules that prevent free radical formation or limit free radical formation. All these we are going to read. Okay, but first of all, what are peroxisomes? They are small bodies. Okay, small bodies, membrane bound, which are present in the cell. They contain a few enzymes, but the most important enzyme contained in peroxisome is the most important enzyme. Can any of you tell me the most important enzyme contained in peroxisomes? Catalase. Okay, catalase is the most important enzyme contained in peroxisomes. Alright. Now catalase, it as the name suggests, it will catalyze something. Okay, what will it catalyze? It will catalyze something in the peroxisomes. So all these names are interconnected. Peroxisome means peroxide, related to peroxide, something related to peroxide. Catalase means something related to catalysis. So this catalysis is going to occur in some reaction involving peroxide. Understanding? This is how you should interrelate. This is how you should interconnect all these things. Okay. So what are we going to read? Let us first start with free radicals. Okay. Free radicals are such compounds that contain an extra electron. Okay, an extra lone electron, which is not paired. So this electron is highly unstable and it wants to become stable. Okay, so what will they do? This electron will want to go somewhere. Okay, it will want to go and form a bond with some other compound. It will want to pair up with another electron. Okay. So, what are free radicals? Containing an extra electron, unpaired electron. Okay, so this is highly unstable. What is this? Highly unstable. So, what will happen? Suppose this is the hydroxyl free radical. What will happen? This electron, this is the minus charge because of this extra electron. So this electron, it will want to go and hop onto some other compound. Suppose this is the molecule. This will go and want to hop onto one atom on this and form a pair. So loss of electron is what? This will want to this will want to take one electron here from other compounds. Okay, so the compounds will lose the electron. Okay, these compounds will lose the electron. Now this is a lone pair of electron. It will want to form a pair. Okay, so it will extract electrons from compounds. This is an extra electron. It wants to exist as a pair. So what will it do? It will extract electrons from anything that it comes across. It will want to take electrons. So taking electrons from something, this will lose electrons. So what will this become? This will become oxidized. So what do free radicals do? They cause oxidation. Free radicals cause oxidation of tissue, of cells. Okay. Now this oxidation is leading to degradation and aging, diseases, and maybe death. So free radical damage is very, very common. Okay. So how are these free radicals produced? free radicals are produced inside the body through various processes. Okay. Now, okay. And what does it form? Hydroxyl free radical. It also has a lone electron, unpaired electron. Okay, got it? So this is how these free radicals are formed. Okay. Now I'll show you how these free radicals are removed. Now these free radicals cause oxidation. Now something that will prevent the formation or remove them, they will be anti of them. That is, they will be opposite of them. So opposite of something is anti. So anti of oxidation is antioxidants. So antioxidants will remove free radicals or they will prevent free radicals. Got it? So one is the superoxide dismutase. What is this doing? This is removing this superoxide free radical. Another, vitamins A, C and E. ACE vitamins will remove the hydroxyl free radical. Okay. Now, there is this enzyme catalase. Where is it present? Where is it present? Catalase in the peroxisomes, isn't it? Catalase is present inside the peroxisomes. This catalase, it converts hydrogen peroxide into what? Water, harmless and oxygen. Okay. And there is another enzyme that converts hydrogen peroxide into water, harmless water, and this enzyme is what? Glutathione peroxidase. Okay, glutathione peroxidase. Got it? Understood? Glutathione peroxidase involves conversion of reduced glutathione to oxidized glutathione. Then again, this reduced glutathione is converted through glutathione reductase, utilizing NADH. Understood? Following this whole reaction, or look at this reaction once, look at it for whole 1 minute, try and understand, and then I'll tell you the intricacies. Okay, this is not a complex reaction. I have made it from scratch, so you know this is not a complex reaction. Even you can make this. Okay, and then I'll tell you the intricacies one by one. This all is involving free radical formation and antioxidation. Okay, please try and understand this. What happens here, I'll discuss. Okay, understood? So, what happens is, there are two free radicals that we are discussing here. They can be a lot more. Okay, now oxygen is getting converted into the superoxide free radical. This superoxide free radical is converted to hydrogen peroxide, which is not a free radical. Okay? But this hydrogen peroxide can convert to another free radical, which through the Fenton reaction that involves the ferrous ion. This free radical is hydroxyl free radical. Now, superoxide free radical was removed by superoxide dismutase. Hydroxyl free radical is removed by vitamins A, C and E. Okay. Now, what happens if this hydrogen peroxide is converted into hydroxyl free radical? Then these vitamins will come in. But there are two enzymes that can prevent hydrogen peroxide from getting converted into a free radical. Okay, so prevention of formation of free radicals. Peroxide dismutase and vitamins A, C and E are coming after the free radical has formed. They have come to remove the free radical. Okay. Whereas catalase and glutathione peroxidase are coming to prevent the formation of, they are coming at hydrogen peroxide stage where no free radical has yet been formed. Whereas superoxide dismutase is also acting on the free radical. Vitamins A, C and E are also acting on this free radical. Understood? So their mechanism is different. They are acting to remove the free radical, to prevent the chain of free radical formation from progressing further. Whereas catalase and glutathione peroxidase are coming to prevent this from going towards the hydroxyl free radical formation. So what will they do? Catalase will convert it into hydrogen, into water and oxygen. Catalase is present where? In our star peroxisomes. So in peroxisomes, whenever hydrogen peroxide is formed, catalase is present there, which will convert it into water and oxygen to prevent any free radical formation. Got it? Okay, the other enzyme present in peroxisomes is oxidase. Okay, now this hydrogen peroxide can also be converted to water, to glutathione peroxidase. Glutathione peroxidase is a very important antioxidant. Nowadays, it is being marketed through glutathione pills and all, right? So marketed all these. But glutathione is a very, very important antioxidant. It is formed from glutamine and it contains a very important amino acid, the 21st amino acid that is also present in deiodinase enzyme, which we have read in the chapter of lysosomes just in the evening. Deiodinase, which removes the iodide and the tyrosine residues from MIT-DIT. Deiodinase, which converts T4 to T3 in peripheral tissue. Deiodinase, which contains selenocysteine. Glutathione peroxidase also contains selenocysteine. This is how you should revise, guys. This is how you should revise. Once from jumping from one topic to the other in no time. You should not take a single moment, no moment of hesitation from jumping from here to there. What flies faster than the wind, guys? What flies faster than the wind? Your mind. Your mind flies faster than the wind. From here to there to there to there in no time. Okay? So that is how you should read. Okay? Now, this glutathione peroxidase, this function, what does this do? It converts hydrogen peroxide into water, and this reduced glutathione will in turn get converted in turn get oxidized into oxidized glutathione. Okay, this glutathione peroxidase will reduce this hydrogen peroxide, and in turn reduced glutathione will be oxidized. Okay, now we need more reduced glutathione molecules for other antioxidation reactions. So now will come the reducing elements of our body, that are NADPH2 molecules. Where have these NADPH2 molecules come from? I think just 2 days ago we read the chapter of HMP shunt. Not 2 days, just in 2 days ago we had one MCQ session on Unacademy Future Doctors, where we had read about the HMP shunt or the pentose phosphate pathway in one of the MCQs. What did we read? The HMP shunt does not produce any ATP. It is an alternate pathway for glucose metabolism. No ATP is produced. Rather, what is produced? Reducing elements, NADPH2 and ribose, which is used for DNA synthesis. And what else? What else is produced? There is something else, glucuronate molecules. Glucuronate molecules used in uronic acid pathway to remove xenobiotics. Okay. Now this NADPH2 gives its reducing factors to, the reducing factors are H plus ions. This it will give to this oxidized glutathione to again convert this to reduced glutathione, and then the cycle can continue. Okay. Got it? Now what happens is, in the erythrocytes or the red blood cells, they contain this glutathione peroxidase. Okay. Now if there is G6PD deficiency, what is this G6PD? Glucose 6-phosphate dehydrogenase. It is the first enzyme involved in hexose monophosphate shunt. What does this do? This G6PD enzyme is going to convert glucose 6-phosphate, that is the starting molecule of hexose monophosphate shunt, into 6-phosphogluconate. Okay, then the cycle continues, but the starting enzyme is G6PD, glucose 6-phosphate dehydrogenase. If there is G6PD deficiency, if there is glucose 6-phosphate dehydrogenase deficiency, then what will happen? NADPH2 molecules will not be produced, reducing elements will not be produced. The erythrocytes or the red blood cells will have a lot of free radical formation, and these free radicals are going to oxidatively damage the RBC. Okay, because glutathione peroxidase cannot function. Why can it not function? Because NADPH2 is not there. You see, NADPH2 is not there. So, this reduced glutathione cannot be synthesized. Okay. So, what will happen? RBCs will die. RBCs will die. What is it called? Death or destruction or breakage. Hemolysis. Lots of RBCs dying will lead to anemia. So, it is called hemolytic. Yeah. Hemolytic anemia is due to deficiency of G6PD. And why is it? We have just understood. Got it? Understood? Now, just as we are discussing about antioxidants, I'll classify them. I have already told you. I'll just write this down for you to make a note of for your exams. Okay, antioxidants can either act at pre-initiation stage of free radical formation, or they can, we are talking about their mechanism of action. Okay, or can be a chain breaking mechanism. Now you have to tell me which antioxidants fall in which category. You have read about 4 antioxidants: superoxide dismutase, vitamins A, C and E, catalase, and glutathione peroxidase. Now, which of these, 2 of them act at pre-initiation stage and 2 of them break the chain of free radicals. Can you tell me which ones? Hey, hi Prerna 135 ma'am. Can we follow these lectures for 2021-20 batch? Please the prize ma'am. Yeah, sure Prerna, you can follow these. I am taking a comprehensive series that is called Focus Prof 1, Prof 2. Please attend that. I have taken quite a few lectures in that starting from the first week of January. I have started, and I have started with metabolism. Okay, I have completed most of the metabolical cycles of glucose, of lipids and amino acids. Okay, and right now I'm devising new interactive ways in which you revise all these. So we have completed all of these things, but I'm taking one organelle at a time, and all the reactions associated with that organelle which we have read, I'm cumulatively revising that. Okay, so all of these we have read. Now I'm coming to beta oxidation also, that is occurring in peroxisomes. That also I'll cover, which we have read in the chapter of lipid metabolism. Okay, so different ways I'm devising so that you guys don't get bored, and at the same time you revise each and everything. At the same time, Prerna, I'm taking regular MCQ sessions also, and medical marathon sessions also on Unacademy app. That also you can attend. You will benefit from that. Okay, you can, what I suggest to all my regular students to make a two-pronged study method. Okay, to read from the book and you supplement from these videos, or to read, first of all you attend the video lectures. The audio visual method is very interactive and effective, and then you have understood the whole chapter, then you can read the book, so that that gets ingrained and consolidated inside your memory. Okay, got it. So please, whichever book you are following from, do try and attend these lectures, because it will make all your concepts clear. Okay, I'm just totally against ratification and learning by rote. Okay, so I make sure that you understand, because in books what will be written, two types of antioxidant reactions at pre-initiation stage and at chain breaking stage. But who will understand? At least I did not understand it in my first MBBS. So I want you guys not to repeat the mistakes that I did and to understand it right away, because then you'll have an early kickstart for your PG entrance examinations also. If all your concepts will be clear in the first year, then during your PG entrance preparations it will be a cakewalk for you. Okay, so I want to make sure that your concepts are clear, and second thing, you are learning while you are attending my session. So this same thing I have taught you, I think, almost 5 times in different lectures. Okay, I have been taking lectures for the past 2 months. All the metabolic cycles I have covered, I think, more than 5-6 times. Okay, so all those who are regular with me, they have memorized all the cycles along with me. Okay, and I make sure that I don't put in any printed format here, because any printed material, any printed diagram tends to intimidate at least me. Because any printed molecule, maybe the simplest of molecules, may it be a pyrimidine structure or a purine structure, or maybe a porphyrin structure, that is going to intimidate me, and I feel that I will not be able to draw it. So I just skip that part. But if you make that diagram in your short note, that is going to make your answer leagues more illustrative. Okay, and the examiner will be super impressed with your answer. So that is why I try. Can you see how illustrative I have made this? I could not do this in my first year MBBS. My first year MBBS, all I could manage was writing paragraphs. Writing so humdrum, monotonous paragraphs that I now feel ashamed of that. Okay. So that is why I am telling you guys how to write answers also. Okay. Understood? Now what was I telling? Yeah. So pre-initiation stage and chain breaking stage. Chain breaking stage means breaking the chain of further free radical formation. Free radical formation has started, but the chain free radical occurs in a chain. Okay. Now this contains one lone electron. It will extract electron from one molecule. So this molecule X will now become another free radical. It will extract electron from Y. It will again become another free radical. It will extract an electron from Z. So this is a chain of free radicals that has started forming. Okay. Now what do? A's and vitamins A, C, and E will break this chain. They have converted this free radical into hydrogen peroxide. They have reduced this. Similarly, this also they will reduce this. Okay, got it? Whereas, what will catalase and glutathione peroxidase is going to prevent H2O2 from getting converted into a free radical. What is this free radical? Hydroxyl free radical. So catalase and glutathione peroxidase act at pre-initiation stage. Catalase and glutathione peroxidase act at pre-initiation stage of free radical formation. That is, free radical has not yet formed. Whereas chain breaking uh, antioxidants are superoxide dismutase and vitamins A, C, and E. I hope you all have understood this. Pre-initiation stage है catalase and glutathione peroxidase. Chain breaking, superoxide dismutase and vitamin A, vitamin C, vitamin. Okay, understood. Now, another important aspect of peroxisomes that we should know, and then we'll be clear with the whole biochemistry involved with peroxisomes. Okay, now anyone can ask any question about peroxisomes from biochemistry, and we'll be armed with the answer. Okay, got it? Now, whenever you're reading peroxisomes in physiology, I hope you recall whatever you have read about peroxisomes in biochemistry. You should recall the free radical formation, you should recall antioxidants, you should recall catalase, you should recall beta oxidation of fatty acid, which I'm going to tell you right now. Okay. Now, normally beta oxidation of fatty acids occurs where? It occurs in the mitochondria, but in the peroxisomes also it occurs. For what? Beta oxidation of very long chain fatty acids. What are these? Very long chain fatty acids. Beta oxidation of very long chain fatty acids occurs in the peroxisomes. This is, guys, this is a 5-star question, 5-star information. This is asked a lot of times in the PG entrance examination also, and your short notes, though, it is almost every time asked. Okay, so beta oxidation of very long chain fatty acids occurs in the peroxisomes, and one very important thing is that what forms here? NADPH2 is formed. Okay, NADPH2 is formed. Here also NADPH2 was formed, but one extra thing here is that H2O2 is also formed here. What is this H2O2? This is peroxide. What is this? It is peroxide. So this is what gives the peroxisomes its name. That is, peroxisomes, their name. What is the name of peroxisomes? Peroxisome. So peroxide. Now where is this peroxide coming from? From the beta oxidation of very long chain fatty acids. And to prevent this converting into the hydroxyl free radical, what do the peroxisomes have? They have catalase. Now you understood the whole story, that I was talking about. Okay. Now again, the last thing that I'll tell you about is the Zellweger syndrome. What is the Zellweger syndrome? It's also called the cerebro-hepatorenal syndrome, because it affects the brain, the liver, and the kidney and other organs. These are the major organs. So Zellweger syndrome is due to defective peroxisomes. Okay, it is inheritable. What happens here is that very long chain fatty acids are not metabolized. Their beta oxidation cannot occur. Why? Because peroxisomes are defective. Peroxisomal enzymes are absent. So what happens? They will start getting accumulated, and they get deposited in various tissues, causing a lot of symptoms. And this is what entails the Zellweger syndrome. It has been asked a lot of times, which organelle does it affect? What is the causative agent? Is the accumulation of very long chain fatty acids. Okay, understood. So this is all about peroxisomes that you should know from the biochemistry point of view. Okay, yeah, okay, it's okay, Prerna, you're welcome. So now you're left with, for tonight, you're left with mitochondria. We'll take a break for 5 minutes, and then we'll resume with mitochondria. And tomorrow at that is on 21st at 7 p.m. and 8 p.m. we have 2 sessions. One is tips to increase your productivity, and another is on ribosomes. So all the metabolical reactions associated with ribosomes, that is translation. We are going to read translation also tomorrow associated with ribosomes. Okay, so those we are going to cover tomorrow. Then tomorrow we'll have 2 classes on the Unacademy app as well, MCQ sessions at 10:15 and at 11:15. Okay, so please join those. Now guys, I'm working so hard for you guys, so you guys also should cooperate. Okay, is every day almost 4 or 5 classes, sometimes even 6 classes I'm taking, so that the syllabus gets revised a lot of times. Okay, now also one more thing, I'm going to come up from day after tomorrow, I'm going to come up with a series 2QPD. Okay, just like G6PD which we read right now. So this 2QPD, I've tried to be quite over smart with this. Now I've tried to be quite quirky with the name. This 2QPD, that means 2 questions per day. Okay, it's something from to take something to sound like biochemistry. 2QPD, 2 questions per day I'm going to discuss, and I'm going to do a retrograde analysis of the theory part behind that. Okay, so it will be a quiz also. a short simple quiz, 2Q per day. I'll take 2 classes.